In the case of surgeons, they really dread morbidly obese patients because it's often impossible to offer the required medical help, or perform the necessary surgical procedures, and that's not what a doctor wants. 2. I had a 500 pounds patient recently and his wife asked to speak with me in private. She explained that when her husband was a kid, his dad would beat him, sometimes horribly and sometimes for no reason at all. His mom, doing all she could to help the boy, would comfort him with food. He grew up with an unhealthy connection between food and emotional well-being. When I see morbidly obese people, I think of that guy. 3. I think that many morbidly obese patients only have a vague idea that caring for them can be a high-risk situation. A few years ago I was taking the medical history of a new obstetric patient. As part of my history taking, I always talk about prior pregnancies and whether or not there were any complications. Her first delivery was via cesarean. When she went into labor for her second pregnancy, she was actually visiting family in a small town. She went to the small community hospital on Christmas Eve. She reported to me that because it was Christmas Eve they did not want to take care of her and they sent her in an ambulance to a hospital in a larger nearby city. She was very miffed that they would not